In the previous module, we talked about reacting to the shock of a Chiari diagnosis and how to talk about a Chiari diagnosis with other people. In this module, we will review the first important decision that most people must make, specifically finding the right doctor. Chiari patients may see several different specialists during their diagnostic journey, but once an MRI has confirmed there is a herniation, since the primary treatment is surgical, Conquer Chiari recommends they be evaluated by a neurosurgeon. So the question becomes, how do you find a neurosurgeon? There is no right or wrong answer to this question, but there are some important things to consider and steps you can take to increase your chances of finding someone you are comfortable with. First, set emotion aside and ask someone to help. This can be difficult to do, especially if the diagnosis was a surprise or if you have been told for years there is nothing wrong. However, this is an important decision, and a methodical approach can pay dividends. Research has shown that even within the same surgical practice, the specific surgeon can have a significant impact on complication rates and outcomes. Therefore, consider recruiting a friend or family member to help you work through this process. Second, decide what is important to you. It is common for people to want to find the best Chiari doctor in the world. Unfortunately, there is no objective way to define who is the best. Chiari is not a recognized neurosurgical subspecialty, and data comparing outcomes and complication rates between surgeons is not available. What is right for one person may not be right for someone else. Think through what you, as a patient or parent, feel is important in a doctor. Some things to consider in this regard include location. Are you willing to travel, or would you rather stay local near your support system? Think about this carefully. Traveling when you are going to have surgery can entail a lot of added effort. Another question to ask yourself is, what type of surgeon do you want? Oftentimes, people want to know where Chiari research is occurring, which will tend to be at large university-based medical facilities. This is a perfectly fine approach, but keep in mind there are many surgeons who have not published research on Chiari but are perfectly capable of treating Chiari patients. Similarly, consider whether you want someone who does a lot of Chiari surgeries or a general surgeon. Some people are only comfortable with someone who does many Chiari surgeries a year, and that's okay. But if you don't want to travel, another measure of a surgeon's skill is how many surgeries they do a year of any kind. A very busy surgeon is likely a skilled surgeon who has built up a wide base of surgical experience. One way to approach this question is to consider, do you have a straightforward case or a complicated one with multiple problems? Someone with a simple Chiari and no other abnormalities may be comfortable with someone who does not focus their practice on Chiari. On the other hand, someone with a complex anatomy or whose surgery failed the first time might want to get an opinion from someone with a lot of Chiari experience. Another important consideration is whether bedside manner is important to you. Do you care more about the surgeon's skill, his ability to be compassionate and listen to you, or a combination of both? There is no right answer to this question, just individual opinions. A final consideration is insurance and cost. Depending on your specific health insurance, your in-network choices might be limited, and you might have to factor in whether it is worth it to seek care outside of your network. Once you have thought these things through, the third step is to create a list of candidates. You can build the list from a number of sources, including the American Association of Neurological Surgeons website, which has a database of members that can be searched by city, state, and zip code. If you live near one or more universities with medical schools, their websites will list neurosurgical faculty, and you can contact the department to see which surgeons perform Chiari surgeries. A great way to add to your list is to ask everyone you know, especially people in the medical community, such as nurses and other doctors, who they would go see if they had an uncommon neurological condition. You may find that the same one or two names keep coming up because they have the best reputation among professionals in the area. Now that you have a list of surgeons, the fourth step is to rank them based on your specific criteria. To do this, you will likely have to do additional research. You can look up their bios online and see where they went to medical school, did their residencies, how long they have been in practice for, awards they've won, etc. You can also use Google Scholar or PubMed to see if they have published any Chiari-related research. From this, you may be able to find roughly how many Chiari surgeries they've performed, get a feel for how aggressive or conservative they are in terms of recommending surgery, what their surgical complication rates are, and how their patients have done overall. Just keep in mind that outcomes reported by surgeons tend to be more positive than outcomes reported by patients. Also, now that you have specific names, circle back around to people you know in the medical community to see what their reputations are like. With your ranked list, the final step is to make an appointment and see what you think. Start at the top. Meet with the surgeon and see what your impressions are. Do you get a good feeling? Can you communicate with him or her easily? Did they answer your questions? Does their treatment plan make sense? Can you see letting this person operate on you or your child? If so, you probably found a good doctor for you. If not, consider going to the next person on your list. If you decide to see multiple doctors, keep in mind there's a good chance you will hear different opinions, which for some people creates more confusion. In the end, trust yourself, you know what's best for you.